Hello there, I am Dr. Petrache, diabetologist, and for today I will talk about insulin resistance. Let's see what insulin resistance is and why is it so important to test it. Well, it seems that the main cause of type 2 diabetes is insulin resistance. Practically, insulin fails to fulfill its role for various reasons, and the pancreas produces insulin in excess to counteract this problem. Over time, hyperproduction of insulin will lead to the exhaustion of the pancreas. This will lead to prediabetes and type 2 diabetes. It is good to test your insulin resistance to find out if you are predisposed to the onset of diabetes, but I do not recommend you to test insulin resistance if you already suffer from prediabetes or type 2 diabetes. It is also not recommended to do this test if you suffer from any chronic inflammatory disease such as polycystic ovary syndrome, thyroiditis, rheumatism, and so on. Why not? Because any inflammatory disease increases insulin resistance, and the chronicity of the disease makes it virtually unbeatable. There is no obese patient or patient with chronic inflammatory pathology who does not suffer from a certain degree of insulin resistance generated by the disease itself. Of course, in the case of the obese patient, the solution comes from losing weight, but in the case of the other patients, solving the insulin resistance is problematic. However, I recommend that you measure your HOMA index for insulin resistance and see a diabetologist for interpretation. I do not recommend that you diagnose yourself based on the reference interval observed on the analysis report, a situation I have faced frequently in the last period in the office. That's it for today. I am Dr. Petrache, and until next time, take care of your soul and body.